Hello, for this week we have a Caucasian female. She appears to be in her late 50s and early 60s, who presented with anxious belief that she has stomach cancer. She has a chief complaint of having a terminal illness of stomach cancer, and the client says that she feels that she has a tumor in her stomach that tightens and loosens like a spring. She appears extremely anxious about her beliefs that she has cancer and that she's going to die in a few days or weeks. The client is asking for medical help, such as chemotherapy or surgery, for treatment despite all of her exams, labs, and imaging being negative. The client also mentioned that she needs assistance filling out her will and actually states, I will be dead by then when the clinician suggests group therapy for treatment. So the diagnosis that I gave her is hypochondriasis, and I arrived at this diagnosis because the client displays all of the symptoms and the criteria in the DSM-5 for the diagnosis. According to the Kaplan and SEDEX, the primary DSM-5 diagnosis criteria for illness anxiety disorder are the patients being preoccupied with a false belief that they have or will develop a severe disease in the presence of few, if any, physical signs or symptoms. And we can clearly see this during the interview. She is definitely preoccupied. Her entire thought life and her everything just revolves around her beliefs that she has cancer. And the remaining DSM-5 criteria are the duration of symptoms are greater than 6 months. And we know this because the client has also had an episode similar to this last year when she thought that she had ear cancer. Also, the client has to be anxious about the belief, and we can clearly see that during the interview that she is very anxious about the belief of having stomach cancer because she's raising her voice, she's clenching her fist, and like moving her hands really rapidly during the interview. And then the last criteria in the DSM-5 for this diagnosis is excessive health-related behaviors related to the belief or seeking care. And we can clearly see this in her. The client has seen several doctors for the concern of stomach cancer, and she is willing to even to take chemotherapy and medications and have surgery for her belief of having this cancer. So, Axis 1, mental health and substance use disorder is unknown because this was not reviewed during the interview. Axis 2, personality disorder and mental retardation. She does not show any signs of mental retardation. But we are not sure about the personality disorder. General medical conditions. She appears to be in relatively good medical health. I came to that conclusion because her skin is intact. She can maintain an upright posture. She is alert and oriented times 4. Also, she has clear speech. And I didn't see any signs of any tics or tremors. When it comes to her psychosocial and environmental problems for Axis 4, she did state that no one in her family believes that she is truly sick, and this causes her great distress, and she believes that she's going to die alone. Axis 5, overall function. I believe she has poor function given that she's become obsessed and extremely anxious with the belief that she has terminal stomach cancer. Her thoughts revolve around the fear and anxiety that she has a terminal illness and she's going to die soon. So she really can't function greater than that because she's just so preoccupied with the fear of dying. Also, the differential diagnoses. Now, when it came to that, the first differential diagnosis was a conversion disorder or somatic symptom disorder. And according to Kaplan and Sadek, with somatic symptom disorders, there is a significant health concern along with substantial somatic symptoms. During our interview, however, the client does not complain of any significant somatic symptoms besides just the spring that she feels in her stomach. And the emphasis between in order to make the different diagnosis between the somatic disorder and the hypochondriasis is that it's the fear of having a disease versus the emphasis on somatic symptoms for conversion disorder. And differential diagnosis was a fictitious disorder, and this fictitious disorder is faking or of physical or psychosocial symptoms that can be imposed on themselves or others, and um, like misleading the medical team in order to get empathy from others. But um, I did not arrive at this diagnosis because she was not trying to mislead the medical team with false information, and she was not resistant to allowing the treatment team access to outside records. So I ruled this diagnosis out. The information that we got from this interview to confirm the diagnosis was that the client, she feels very anxious and she shows physical signs of anxiety and fear about being terminally ill. Also, she has seen multiple doctors without without any signs. She has normal labs, normal tests. There's nothing to support that diagnosis that she believes of stomach cancer. And then etiology. I believe that she mentioned during the interview that her grandmother died of an undiagnosed brain tumor, and this was a great source of anxiety for the client, and it later manifested as the hypochondriasis. And finally, for a treatment plan and strategies, what I would recommend is CBT and psychodynamic therapy. Um, there has been several studies showing that CBT interventions are the best type of therapy in the first line treatment for this diagnosis. And for pharmacological treatment, I would recommend the SSRI fluoxetine, 20 milligrams daily. I'd be sure to educate the patient on the side effects of the medication as well as medication interactions, such as with NSAIDs. And I would like to see her in 2 weeks to see how she's doing with the treatment plan.